Okay, this video is called Defecation Secrets. Secrets about having a good normal bowel movement and all the things that have to do with having a bowel movement. And there's a couple things worth knowing. First of all, at night, you want to get these lights off. These are bright overhead lights I have in my kitchen, and here's the bright overhead lights I got in my bathroom. You can see here that I tape on my mirror my workout numbers, how many push-ups I could do, how many chin pulls I could do and curls and stuff. So I'm always keeping track so I make sure I'm improving. But anyways, the light's too bright. So here's my first trick. Your gut develops a schedule. I always have a number 2 first thing when I wake up, a number 2 right when I get home from work, which works out fine in the summertime, but it can be a problem in the winter if I'm dressed in layers because your gut knows when you're home. And it says, oh, you're home, now it's a good time to take a bowel movement, but you got to take off all these layers, so you have to make a run for the bathroom, try not to mess up the carpet. Okay, the next point is that you got to take that bowel movement after dinner because your colon hangs on to the stool until it knows that you're well hydrated because it keeps on pulling water out of the stool to make sure you have enough hydration in your body. So it's after you eat dinner, after you have a big meal, that your colon says, oh, now's a good time to defecate, get this old stuff out of there. We don't need it anymore. I got plenty of new food and water coming in. So anyways, at night though, you don't want to put bright lights on. These lights up here, these bright lights, they'd wipe out your melatonin real fast. Same thing with the real bright lights in the bathroom. So I want you to see my new wonderful magical solution. I got little night lights. These are little red night lights on the wall. Plus, when the light comes from the ground, it's like a fire, it hits the top of your retina and your body senses that more as being like a campfire or something. It's not bothered by it. It doesn't have much of an effect on your melatonin. Whereas a bright light coming from above hits the bottom of your retina and your brain senses that as more like daylight, sunshine, and it lowers your melatonin production. You want your melatonin production to be good because it helps you to sleep. Okay, so anyways, this may not seem like a big deal to you, but this was a big major advance for me in terms of not having to put lights on at night when I had to take that post-dinner number 2. Because I eat the OMAD diet, 1 meal a day diet, because it's convenient for me. It frees up my entire morning so I can work like a maniac when I'm at my regular conventional medical doctor job, or I can work like a maniac on writing my books when I'm at home, which is what I want to do. So that's why I eat the OMAD diet, for the convenience of it, okay? If it wasn't for the convenience of it and I was a free man and I didn't have to work, I'd probably eat twice a day, maybe. But anyways, these night lights, trust me, it's a great thing. I don't need bright lights at night anymore. And you notice the light on my alarm clock's a red light. And that's what you want. You don't ever want a blue light to see a blue light at night because your brain perceives blue as daytime. Okay? All right, now I got a couple more slides. We're going to really get sophisticated here. Here, by the way, is a slide. This is an old Dr. Dennis Burkitt slide and Dr. John McDougall. And basically, we're the 3 Irish doctors, okay? I'm half Irish, half Puerto Rican. McDougall's an old Irish guy. Dennis Burkitt was a Christian missionary to Africa. And this is what Dennis Burkitt figured out. He said if you have small bowel movements, small stools, you need a big hospital. If you have a big bowel movement, you don't need big hospitals because everybody's healthy. He had been a general surgeon. I think he did med school in Ireland, I think. And then I know he did some of his residency in general surgery training and clinical work in England. And then he went as a missionary to Africa. And what he saw was the Africans eating their traditional plant-based diets. They were quite healthy in terms of not having the Western diseases. They don't get the Western abdominal diseases. And he came up with this concept of abdominal pressure syndrome. I'll show you a picture of that in a moment. Whereas the Westerners eating a diet that was low in fiber, high in dairy products, high in animal foods, they would have very small stools because the dietary fiber adds water to the stool. It attracts water to the stool, so the stool is more bulky, and the bowel movement's more like a cow patty or a swirly, if you will, and it's a softer bowel movement. Versus when you have a lack of fiber, you're dehydrated, you're eating dairy products, all things that contribute to constipation. You end up, popping out little goat pellets or things like hard Tootsie Rolls. Okay, constipation. Then you got to strain your abdominal muscles. That's called the Valsalva maneuver to push the stool out. Because when you have a bowel movement like this, because the bulk of the stool stretches the rectal muscle. So when you're in a safe place to have a bowel movement, like you come home at the end of the day after work, it's a reflex contraction. All you have to do is say, I'm safe. The voluntary, external part of the sphincter can open up, and then the internal part just does its job automatically, and having a bowel movement is essentially effortless. That's how it's supposed to be. Versus when you got goat pellets, because they're dried out, they don't push against the wall of the rectum, and thus, in order to evacuate them from your body, you got to tighten up your abdominal muscle. Again, it's called the Valsalva maneuver. That causes increased abdominal pressure, which pushes up on your stomach, pops your stomach into your chest. That's called a hiatal hernia because it goes upward through the hiatus of the esophagus, and then it causes loosening of the lower esophageal sphincter. You get gastroesophageal reflux disease. Okay. You'll also get back pressure in your sigmoid colon, and you'll pop out little diverticuli. That's called diverticulosis. One of those pops, that's diverticulitis. Itis means inflammation of the adjacent fat, the mesenteric fat. At least one patient gets admitted to every Western hospital every week from that. Some other things. When your stool's dried out like this, over here in your appendix on the right side, it comes off it's like a little pinky finger hanging off the cecum, the bottom of the ascending colon. That gets plugged up with dry stool balls, which can calcify, become a fecal lith. Lith means stone. Feces is stool, so fecal lith. It's also called an appendical lith. It'll plug up that little appendix ostium, and then the mucus-secreting glands distally can't get their mucus into the cecum, so it'll stretch and then pop. That's appendicitis. Okay, so being constipated increases the risk of appendicitis, diverticulitis, hiatal hernia of the stomach with gastroesophageal reflux, which then increases your risk of Barrett's esophagus, esophagitis inflammation with eventual increased risk of esophageal cancer or gastroesophageal junction cancer. That's become a pretty common cancer. It used to be squamous cell and smoker-drinker types, and nowadays it's more often adenocarcinoma from gastroesophageal reflux types. What else? You'll get down pressure into your legs, the venous pressure from increasing your abdominal pressure with the Valsalva maneuver every day, and you'll get varicose veins. Down pressure into the scrotum, you're going to get scrotal varicocele, dilated veins in the scrotum that can cause infertility. Increased hernias of the muscular wall, periumbilical hernias, inguinal hernias, okay? All of these things are abdominal pressure syndrome from eating a low-fiber diet. And like I said, too, when you're dehydrated, your colon's going to hang on to the stool so it can pull more water out of there, okay? And so the stool's going to become more hard and dry. All right. Now, I actually drew a picture there. It's kind of fun to see an old Dennis Burkitt slide when you see Dr. McDougall, the three Irish doctors. See, we're good at nutrition type stuff. Okay, here's what I was just talking about. Hiatal hernia, reflux esophagitis, lower esophageal sphincter gets loosened. You get reflux into the esophagus, esophagitis, eventual increased risk of esophageal cancer. Same diet's going to be high in fat. Most gallstones, 95% of them are cholesterol gallstones. So in the same patient, you'll see. By the way, I coined the term for this, the Western abdomen, because you see all those things in the same patients. The same patients get gallstones. The same patients get kidney stones. The same patients get calcification of the kidney tubules and then go into renal failure. The same patients get spinal osteoporosis from all the dairy and the meat. The same patients get degenerative disc disease from the spinal ischemia, as well as the crap in the processed food that weakens the collagen in the ligaments and the fluoride in the water that weakens the ligaments, okay? What else? All right, I talked about those. Also rectal hemorrhoids. Okay, so that's all. This is all the manifestations of abdominal pressure syndrome. Okay, the next thing I was going to talk about a little bit about gut turf wars. How do you win the turf war in your gut? What happens with most people is they're constantly going back and forth between animal foods, processed foods, and plant foods. So what you want to do is just go all plant foods. Because what happens is when you eat the animal foods, you're feeding the bad bacteria, so to speak. When you eat the plant foods with all the fiber, you're feeding the good gut bacteria. And there's a turf war in your colon for who's going to control the territory. So if you're constantly going back and forth between processed foods, animal foods, and whole plant foods, the bacteria are constantly fighting it out. You're going to get bloating and cramping, intermittent, diarrhea, episodes of constipation, etc. But if you're just eating the good, healthy plant foods all the time, then you got the good gut bacteria are in total control of your colon, and they're just going to do their job and mind their own business. That's what you want. So the turf battle stops. And your gut just calms down, does what it's supposed to. You wake up in the morning, take a crap. Come home from work at the end of the day, number 2. Eat a big dinner, number 2, go to bed. Okay? And that's how it works. And if you use those night lights, then you won't crush your melatonin by having to put the lights on when you number 2 at night. What are a couple other things that might be useful to you? You don't want to be putting your phone in your back pocket. It appears that is increasing the risk of rectal cancer. I'm seeing a lot of rectal cancer patients. And, I see all these people walking around with their phone in their back pocket. I think that's stupid. I see a lot of people with their phone in their front pocket. That increases your risk of breast cancer. Should not do it. Hold it in some external bag. You don't even really need it with you. I hate the damn cell phone. Let's see, what else can we say here? Other things that cause constipation, opioids, being sedentary, exercise helps decrease the risk of that. Some diseases, diabetes, some medications, some medical conditions as well, Parkinson's disease. What else? If you want to time your gastric transit time, you just drink beet juice. Beet juice turns your stool red, so if you drink the beet juice, mark down what time it is you ate it, and then when you have your bowel movement, and you'll see that your bowel movement will be like, let's say, 1 day later. And then you'll also see you'll still have red stool for another day or two, meaning that it takes a couple days to clear something out of your colon, even a healthy colon where you eat a lot of fiber. Versus if you don't eat a lot of fiber, you're constipated, it could take 4 or 5 days. And that's also why if you're trying to go on an elimination diet for autoimmune disease or something, you got to give your colon about at least 5 days. Some people say a week before the previous stuff you ate is totally cleared out. You could also trick somebody if you got some like hypochondriac, have them drink beet juice and then don't tell them, and then just come up to them the next day and say, I heard there's a lot of this disease going around where people are bleeding into their bowel movements. I'm like, oh my God, me too. No, it's just from your beet juice. Okay, it's not a big deal. Let's see, is there anything else useful here to say about bowel movements? Have we covered everything I hope to cover? I think we pretty much have. So I hope you found that helpful, and I hope your defecation habits continue to improve.